Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Well, we're on. We keep going with the show. We've had a lot of excellent guests. We've had a lot of authors. But I think it's time that we get back to medical personnel and physicians, because everyone has so many questions. And this is the way that you can have your questions answered rather than going to Google. Talk with a real doctor. And I have a real doctor on our line today, because we're going to talk to ADREA. It's ADREA Samoleski, correct?
Dr. ADREA Samoleski.
Dr. ADREA Samoleski. She is a family medicine physician. And I think we ought to start out with talking about that, Dr. Samoleski. You know, we have internists, we have family medicine, we have other names for physicians. Tell me what family medicine actually means.
So family medicine incorporates all ages and all diseases. They're your primary care doctor. Pediatricians are primary care doctors only for kids, and internists are primary care doctors generally only for adults. My training included all of them. I delivered babies. I took care of children, infants, adults in the hospital, out during training and all those. So that's kind of like, I guess, your typical rural physician is more likely to be a family doc who's going to take care of everybody in the community.
I think we need more of you.
Yeah, I mean, it's a tough field, and it covers a lot of material, so it's a little sometimes a little intimidating to go into just in general.
Will you deliver babies?
No. I did do several, or many, down at Jackson during residency. I don't do it anymore. Our community here in South Florida has plenty of OBGYNs. I will do some basic gynecology services in terms of pap smears and things, and discuss with women, birth control or hormone replacement. But certainly the risks and benefits for me on delivering babies is not a good idea.
I understand. Of course, in an emergency, someone's going to have a baby, you're going to be there, right?
Yeah. If we're on a plane and there's no OBGYN, I will deliver that baby.
Is there a doctor in the house, right?
Yes.
No, that's right. So you actually are someone who will have a patient. Let's say you never met this person before. Mm-hmm. Tell me what you start with.
I start with, why are they there? Lots of people have different reasons as to why they come to the doctor. Sometimes it's for a checkup. Sometimes they have a worry or a concern. And that's what I want to get, I want to make sure that whatever they're there for is actually answered. Because this is a relationship, it's a partnership, and, they have certain goals. And, of course, I have my, goals and ideas, too, but I need to make sure that their problem or concern gets addressed. So that's what I start with.
Yes. Okay. Now let's say this is just they just have come to town and they're looking for now a family medicine, a physician. Mm-hmm. They're going to come to you, and then you're going to get them started on a whole wheel of having the best health possible.
Correct. That is my plan.
And what would you do? I know, of course, you're going to take care of blood pressure, but what do you do? I mean,
so much of it is the history. What people do every day. That is so important for your general health. Knowing what's in their past history, what health problems they may or may not have, what's in their family history, so that I know what problems that might in the future, and knowing what they eat on a regular basis, how much exercise, whether they smoke, all those are really important aspects of them, and of their history, and then of course we do vitals, and then I do an exam, generally speaking from head to, looking what's going on in their ears, what's going on in their heart, what's going on in their lungs, their feet, and try to get, their whole body, and then afterwards, we discuss different discuss some of my findings that I might have found. I discuss the blood tests that I like to order and why, and discuss healthy habits, things that hopefully will make them healthier and hopefully even happier.
All sounds good to me. That's really needed by people because, unfortunately, a lot of people don't have someone that's interested in all that. They may be a physician with a particular specialty, but it sounds to me like you spend time with your patients.
I generally do. I mean, I love spending time with them, and it's time to connect and our time to discover what things might help them be healthier, and that's my goal.
Good. That's a good goal.
Healthier.
That's a very good goal. Now, if someone wanted to visit you, they would come to your office. Is that the 7100 West Camino Real?
Correct.
Suite 121 in Boca?
That is correct.
Okay, and let's see, and I have a number, I think, is 561-717. Is it 6433?
Correct.
Okay, so that's a very good, and if you wanted to go on the web, you could then see how pretty Dr. Samoleski is.
Thank you.
You're welcome. It's westbocafamilymedicine.com. westbocafamilymedicine.com. Okay, so now, what are some of the unusual cases that you may have run into? And I'm not saying to put names in front of it, but what, as a family physician, what has happened that maybe you've discovered that they didn't know before? Is there anything that jumps out at you?
I mean, the person, there's always the sad times where it's a person who, we discover that has a cancer, whether, it's breast cancer or ovarian cancer, lung cancer, all of those are really tough. I have several that jump into my head, and you tear up a little bit with them because it's hard for them to adjust. It's hard for anybody to deal with bad news, and that's always one that nobody wants to hear. But most of the time, it's the everyday things of talking. Okay, well, you know what? Your blood pressure's too high, and we really do need that lower because otherwise, you can develop heart failure. You could have a stroke, or their sugar's too high when we go over blood tests. So it's the little things that unfortunately can build up to very chronic, long-term problems that is generally my focus and my mainstay.
I see. Well, that's really I've always wondered how you can be a physician and get past some of that. You do have death in your, in your practice and all, but maybe it's the bright lights that keep you going when you've met someone and you've discovered something that is going to make their life much better, different, and maybe it equals out.
It does, and sometimes, I look at it as maybe as a teaching moment for me, or for, bad things do happen, but maybe this helps keep me more humble, or it teaches me to keep my eyes open about something else for the future. Or that person ends up being an example to a friend. There's lots of, I don't know those reasons that bad things happen, of course, but there's always some sort of moment in it that can be a little silver lining for someone.
Yeah, I'm sure that is true. And do you have a family yourself?
Yes, I do. I have 2 children, and I am married.
Huh. So you have to work out all this between them.
Yes.
Well, let's just go into family medicine. So I was curious about, do you also work on nutrition? Because, now everything is all the wonderful natural herbs and generic. I mean, not generic, I'm sorry. Just having the very best food, which is medicine. Do you delve into that?
Somewhat. I certainly didn't do. There are institutes that are, focused on nutrition specifically, or nutraceuticals, which would be kind of like the natural medications. I'm aware of them. I do have sometimes concerns here in the United States. We don't monitor they all end up under vitamins and supplements, so they're not monitored as closely. They're not checked in terms of, is this the same? When it says it's St. John's wort, is it really St. John's wort? Because they've done some studies where it's like they put in fillers, or they put in St. John's wort, the root instead of the leaf, or they put in, vice versa. So it is one of those things I just tell, I ask people to be really careful that they get it from somewhere, reputable, from the same company usually over and over. And I'm not promoting USP, but there is an actual agency that will spot check some of these nutraceuticals and supplements and see whether or not they are fulfilling what they promise. Not necessarily in terms of benefits, but they actually have the ingredient in it.
Right.
And then they put a little gold seal on it when it meets their expectations. So that is useful. Nutrition, of course, is very, very important. It's so important for our health. There's new stuff that comes out all the time, so it can be a little overwhelming to people. And a lot of times what I remind them is that I'm going to tell you a lot of the same stuff that your mom probably told you of. You need to eat your vegetables.
Eat your oatmeal, right?
Yeah, or, oatmeal a couple times a week, or just your vegetables. How many times, okay, you got broccoli, you need to eat your broccoli. And I have people that tell me, I maybe only eat 2 vegetables a week. And I'm like, okay.
Really?
That's not enough.
That's right. Well, it's interesting that I now have started taking turmeric. I'm taking it, putting it into my soup, putting it into a lot of things, because I've done a lot of reading about it. So if someone came to you, for instance, as a new patient, would you then work on those things with them?
Sure. I mean, turmeric is supposed to be helpful for anti-inflammatory effects, and there are a couple others that are also very good. There might be some new things with cinnamon being helpful for diabetes.
Right.
Picoline is another one. So I'm certainly willing to work with people, and then if I don't know, I start looking it up, because there's lots of stuff that I don't know, so that I have to look it up, and I'll say, okay, what are you using it for, and and we go from there.
That must be fun. In a sense, you become a research scientist.
Yes, somewhat.
But it's good for yourself and your family also. I mean, a lot of people are on the internet. They get these messages from a lot of places, and so I'm glad you're open. There are some doctors that say, I'm not interested in any of that. They just don't think about it. And so it's good to hear that you seem very open-minded. I really like that. I'm sure our listeners are going to be very happy to meet you.
Thank you.
So
I'd be happy to meet them.
ADREA?
ADREA.
Samoleski.
Correct.
And she's a family medicine practitioner. And she, let me just tell you, this show is really being sponsored by West Boca Medical Center. And we want you to know that Dr. Samoleski is located in West Camino Real. It's 7100 West Camino Real, Suite 121 in Boca Raton, 33433. And her phone number, if you'd like to write this down, remember this is Pencil Talk Radio, so write down 561-717-6433. 717-6433. If you're looking for a new, bright physician, she certainly acts that way. It sounds like she likes people. She wants to be a good doctor. She's inquisitive. All those are good things,
Thank you.
You're welcome.
Thank you.
So, what ages would you say that your practice really consists of? I mean, people 40, 50, 60, is it?
Oh.
Is it vary?
Most of my patients are over 18. Actually, everyone right now is over 18. I'd be willing to see a little bit younger, but not a whole lot younger. I go up to, I think my oldest is 88 right now. The majority of them are anywhere between probably 25 it is an age range, 25 to 70.
Okay, that's a good age range. That's a very good age range.
It covers a lot.
It does cover a lot. So I hope that a lot of your patients got their flu shots.
Yes.
That's really, now they say the flu season is starting to go down, but people still should be very careful. Do you agree?
I agree. I mean, there's still active cases of influenza at the hospital, and in our community. So you still need to be careful. Wash your hands. Try to stay, home if you start feeling sick, and eat those fruits and vegetables again to make sure you have good sources of vitamin C. Those are all really important. And flu vaccine, I strongly recommend it. I do generally recommend it more in the fall and early winter. At this point, it's getting late in the season, so it may or may not be as effective for you. But certainly, if you are worried about it, we still have influenza vaccine available, and people can still get it. Usually, mid-March is usually the latest until the next flu season.
I usually always get my flu shot in October or even early, right? Because
excellent
people come down maybe from up north. They start. Yeah, it's really important, and it's terrible if some people say, "Oh, I never get the flu shot. I never get it." Well, if they had the flu, they would be very sorry, wouldn't they?
Most likely. I mean, for some people that are generally healthy, it might not be too bad, but it kind of feels like you're getting hit by a truck, and you feel like that for about 7 days. It's a long illness, and unfortunately for other people, it can be very serious. They can have problems with breathing, have to be hospitalized, have to be in the ICU. So, it can be a very, very serious illness.
Yeah, and so I'm glad that you push your patients, and I think it's also important that you have your flu shot at your physician's office because they then can keep the record.
Certainly, that's very helpful, and I'm always happy to give a flu vaccine. But if for some reason you don't have a physician,
sure,
I'd rather you get it from somewhere than not get it at all.
No, you're absolutely right. Let's just go over. Can we talk about sleep?
Sure.
I think sleep is a big discussion nowadays, isn't it?
A problem for a lot of people, and some of it is our lifestyle these days. I don't think it's always very conducive to sleep. We have a lot of distractors, a lot of, as I keep telling my children, devices that kind of keep us up and keep us awake.
Yeah, I know that, but it's so important, though. I believe that you really have to get more sleep. I know I'm guilty of not getting it, and everything I read, it's really just not good. How's your brain going to recuperate, and how's your everything else? So I try, but some people even set an alarm now to sleep,
remind them
not
to go to bed.
Get up. Right, exactly. Because you're right, and just think about yourself. That here you have a family, you work, and you have patients to take care of, and it's hard sometimes to turn off the television and go to sleep, and then you have to get up early, and then you might get that call at night because as a family medicine practitioner, you are on call, aren't you? It's not like...
Yeah, I'm on call. And, sometimes it does happen at 12 or 1 o'clock at night. You get a phone call. And so it's definitely tough, and your best sleep is usually when it's uninterrupted. Right now, I think I have more interruptions from my daughter, but...
How old is your daughter?
She's 6.
Oh, yes, I'm sure that's true. I am sure that's true.
But ideally, people should be getting 7-8 hours of uninterrupted sleep if they can.
7 to 8 hours, right.
Yeah.
If you go to the bathroom just for 1 minute and get right back and go right back to sleep, is that uninterrupted?
Oh, I mean, I guess it depends. If you're able to fall right back asleep again, then sure.
Yeah, right. Sure. That's what I can fall right back to sleep.
Then that's not too bad.
Right. So I'd like to cover a couple of more things, and I think that people should, keep all their medications on them in their wallet wherever they go. A lot of people don't, and I know that there have been some emergency situations, and they always ask, well, what are you on? Well, I don't know what I'm on. Or if you have a husband or a wife, so I don't, as a physician, I think it's good advice, don't you, to tell your patients that?
So yes and no.
Oh.
Yes, you need to have a list of your medications. The same way you would kind of have a list of your, list of your emergency contact in your wallet, or
right.
That's what I would prefer to see. What the reason why I say no is that what I've found is that then some people think that if they bring me this little container full of pills, and they say, well, these are my medications. And I look at them and go, okay, I can't identify any of those medications. I mean, potentially I can try to look it up and based on serial number and color and shape and size, maybe narrow it down to a couple. But there are so many generic medications now, which one might, even the same medicine, the same lisinopril, one might be yellow, one might be white, and it's the same exact drug. So that part I'm not so crazy about in terms of carrying stuff around. So I usually just ask, look, either have a list
right.
of all your medications have the latest. The pharmacy always gives you a little slip that they staple to the bag usually,
mm-hmm.
and you carry the latest one of that for all of your medications.
That's good advice. Yes. All right, everybody, you heard that. So you're on medications. Get that list, and you can tattoo it on your arm or you can put it in your wallet. But it is important, isn't it?
Very much so. Very, very important.
Because the emergency rooms, if they don't have something to go by, they could actually give you something that would be detrimental. It could be very dangerous for your health.
Mm-hmm. And speaking of that, make sure that on your medication list is your allergy list. Because we certainly don't ever want to give you medication that you're allergic to. So that's another thing to have. One other technique now with the use of smartphones and things is that I have some people that take pictures of their medication bottles, and they just have a little album that's their medicines, and then they just flip, and they go, here, this is my medicine, rather than writing it down.
Now,
and
that's very good.
That works for me, too.
Yeah, that's a very good idea. Okay, everybody. Well, you've certainly learned a lot from Dr. Samoleski, I must tell you that. So we want to give her every support we can. And if you don't have a physician now, I think you should really make that phone call. And if you do and you're not happy, you can still make that phone call. And remember, second opinions are still in vogue. So if you're going to someone and it's not quite, getting the answers you want, go for a second opinion. And Dr. Samoleski will not have you, will not fault you for that. She'd be glad to look and say, well, you might want to try this or do that. Because years ago, Dr. Samoleski, it was kind of verboten in a sense. People were afraid to go for second opinions. Oh, what's my doctor going to think? But nowadays, it can actually be helpful because in case, even you have a patient and someone else goes to another doctor, mm-hmm. they may come back helping you with something that you hadn't even thought of.
Mm-hmm. That is very true.
So second opinions are really important if you're having any problems. I have a pet, and they wanted to go put the pet with anesthesia to remove a cyst, and I hated to have that happen. So I went to another veterinarian who was in a much larger organization, and the person looked at, forget it, I'll do that in 5 minutes, and it was gone.
Oh, wonderful.
So do you have a
no
pet?
Anesthesia.
Right.
We used to.
Yeah.
She passed away last year.
Oh, sorry.
Yeah,
but you can see that,
they're part of your family, too.
They are.
Mm-hmm.
And, if you have an older person, and as I'm a gerontologist, so I'm just going to say this with that hat on. If you have an older person and they have a little depression, tell them to go get a pet.
Mm-hmm. Pet therapy.
That's right. Pet therapy. So that's, I think, what your particular specialty is. You really are looking at the whole person, aren't you? You're really a holistic physician.
Correct. We're trying to, address the whole person and their multiple issues, psychosocial and medical. It's not just one thing. And you're right, that depression from being alone and isolated is unfortunately very common. And by having, reaching, and you find out because they're living all by themselves. They moved and they don't have their children nearby, or no family, or new college students too. Same thing. You know, they don't have their family nearby and they become very isolated. So learning about their social aspects and their connections to other people is helpful.
You just said something very important. You're talking about college students, new ones, and they can get into depression, can't they?
Yes, they can.
So you will see people, students, won't you?
Oh, yeah. Yes, most definitely.
You really said something very important, because many of them, really, they do bite off more than they can chew with their courses, and then they've never had someone to run everything for them, and I can see where that can happen. And then we don't want them to go to drugs or anything like that.
Right.
So that's great. Well, this has been a wonderful interview. I'm very anxious to meet you, actually. You have piqued my interest in your family practice. So let me just tell you again, it's Dr. Samoleski, and you can reach her at, I'll give you the phone number. It is 561-717-6433. She's located at West Boca Family Medicine at 7100 West Camino Real, Suite 121 in Boca Raton. And I do thank you so much for taking your time with this.
Thank you so much, Anita. It was lovely speaking with you.
Well, you're really great. Thank you. I'll talk to you another time, I hope.
Great.
All right.
Look forward to it.
Thank
Take
you.
care.
Goodbye.
Be well. Bye-bye.